point out the symptoms of canine lymphoma. Canine lymphoma is a common and aggressive cancer that affects the lymphatic system in dogs. It can manifest through various symptoms depending on the stage of the cancer and the area of the body affected. Below is a more detailed description of the symptoms from early stages to advanced stages. Early symptoms: swollen lymph nodes. Characteristics: the most common early symptom is painless swelling of the lymph nodes, especially in areas like the neck, armpits, and groin. These swollen lymph nodes are usually firm and movable. Example: if you feel a hard, movable lump in these areas while petting your dog, it might be an early sign of lymphoma. Weight loss and reduced appetite. Characteristics: dogs may gradually lose weight and show a decreased appetite. This change is usually gradual but noticeable if the dog is eating less and losing weight. Example: you might notice your dog is eating less food and is visibly losing weight. Lethargy and weakness. Characteristics: the dog may show signs of low energy, reduced activity, and overall weakness. Example: a typical active dog suddenly becomes lazy and uninterested in playing or walking. Progressive symptoms: generalized lymph node enlargement. Characteristics: the swelling extends beyond the initial area and affects lymph nodes throughout the body, including deep nodes in the chest and abdomen. Example: you might feel more lumps during grooming or bathing your dog. Fever. Characteristics: some dogs may develop unexplained fever as the body's immune response to the cancer. Example: if your dog feels unusually warm and shows signs of fever without other infection symptoms, it might be a sign of lymphoma. Breathing difficulties. Characteristics: enlarged lymph nodes in the chest can press against the trachea, causing breathing difficulties. Example: noticeable rapid or labored breathing or coughing, particularly at rest. Abdominal swelling. Characteristics: if the cancer spreads to the liver or the spleen, these organs may enlarge, leading to abdominal swelling and discomfort. Example: a visibly swollen abdomen, which may be hard to touch, coupled with decreased appetite and vomiting. Skin lesions. Characteristics: skin lymphoma may cause nodules, ulcers, or plaques on the skin, which may itch or hurt. Example: unexplained skin sores or lumps that don't heal over time. Gastrointestinal symptoms. Characteristics: if the gastrointestinal tract is affected, symptoms like vomiting, diarrhea, and abdominal pain may occur. Example: frequent vomiting or diarrhea without dietary changes, indicating intestinal involvement. Diagnosis and treatment. Diagnosis: fine needle aspiration biopsy, extracting cells from the swollen lymph nodes, or for microscopic examination. Imaging tests: X-rays, ultrasound, and CT scans to assess the size and distribution of the lymph nodes and the involvement of internal organs. Treatment: chemotherapy, the primary treatment method for lymphoma, effective in extending the dog's life and improving quality of life. Radiation therapy, used for localized lymph node enlargement to control tumor growth. Surgery, In some cases, surgical removal of the affected lymph nodes might be necessary. The effectiveness of lymphoma treatment and prognosis depends on various factors, including the type of lymphoma, the stage at diagnosis, and the promptness of treatment. Early detection and timely treatment can significantly improve the prognosis. If you suspect your dog might have lymphoma, consult a veterinarian for a thorough examination and appropriate treatment.